Welcome to Notes from No More Hygiene with Steve Anderson, Dr. Tommy Nabors. Tommy, good day.
Good morning.
We're going to talk about a company that's doing some pretty remarkable research on Alzheimer's and periodontal disease. So why don't you give us the latest update?
All right. Well, it's exciting because this information just came out yesterday, and Cordyzyme is a company out of San Francisco that's been researching Alzheimer's disease and sort of the decrease in cognitive function in Alzheimer's disease and what's causing that. And we've referenced Cordyzyme company in different studies over the past, almost probably 2 years now. And they are concluding their research. They're about 90% complete, and they just kind of released their findings yesterday. And from a business model standpoint, this was released on Business Wire and Investor Ideas as an investment company. But you're talking about a company that spent about $150 million on this project, and it all centers around the oral pathogen Porphyromonas gingivalis being a causative agent of Alzheimer's disease, which would revolutionize Alzheimer's care.
And so they've specifically identified that as the causal agent or a causal agent to Alzheimer's.
Absolutely. And they presented this research recently at the International Association of Dental Research at the 2021 General Session. And they are constantly researching how their drug medication, and I cannot pronounce the name of this drug yet because it's not been formally released.
You got a few months to practice.
I know. It's coming out. But the point is, it's all around destroying and invading the biofilm and eliminating Porphyromonas gingivalis in the mouth prior to it having the ability to transfer to the brain.
All right, so let's talk real quick about you're always talking about credible research and looking at the source. So let's address that real quick. Credible source of research findings.
Right. I mean, when we're looking at research, of course, you've got the kind of research that comes from your friends. When somebody tells you something, or Facebook. And then you've got the kind of research that comes from a mentor or an education platform. But I think ultimately peer-reviewed clinical research is going to be independently reviewed for its accuracy. And so anybody can produce a study, for instance, that they want to release a product on and sponsor the study, and they have to disclose that, right? That this product works, but by the way, I'm an investor in this product. I mean, so doesn't mean that it's wrong. It just means that those are disclosures. And so Cordyzyme is a company, and of course they're researching their product is going to be a medication. But the whole point of their research, which that's independently done, is on the targeted agent Porphyromonas gingivalis, an oral pathogen, and that being the causative agent. So the important thing is you've got an enormous amount of money. The stock price on Cordyzyme yesterday went from $66 to $97.
Are you pitching stocks, Dr. Nabors?
Yeah, I'm not pitching stock, but you should probably look at this. We may have already missed the boat on it, honestly. But at this point, investors aren't dumb, and medicine's not either. And when medicine feels a breakthrough coming, and you've got this amount of money being pushing this particular product and research, then there's no question about where we are in dentistry and our fight against controlling systemic disease. It's just another strong reference that says what we're doing is correct, and that our methods of destroying the bacterial causes of periodontal disease are now being so much more researched about what they're doing on other diseases, and specifically Alzheimer's. And you're going to hear a lot about that between now and the end of the year.
So this piece of research is 90% complete. So they anticipate by November, they'll have the complete research report out. But all the data points say that PG is a causal agent of Alzheimer's disease, which is another significant breakthrough. So an incredible source of research. So what does it mean to those that are seeing patients every day in your practice? A significant conversation about the importance of staying on track with your regular visits so that you stay healthy. The oral systemic link is alive and well. The research continues to compound. And one more reason for your patients to stay on track with your practice. So talk about this every day with every patient. Dr. Nabors, thanks for the update I'm going to go check my stock ticker.
Me too.
Make sure that you join us for our next No More Hygiene course coming up. You can go to nomorehygiene.com for upcoming dates and registration. I've also included a link to the press release on this research that we've talked about today. So Dr. Nabors, thanks for sharing with us, and we look forward to seeing you all at our next No More Hygiene course.
All right. Thanks, Steve.